Barb, can you unmute yourself for a sec?
Yes, we do. We're 19.
Got it. And we have Dr. Branch.
He's here. Yes.
Excellent. Welcome, everybody. Today is the fourth meeting of the Baltimore County delegation, February 4th, 2022. Today, we'll start off with a presentation from the Baltimore County Department of Health with the esteemed Dr. Gregory Branch. Dr. Branch, it's a pleasure to have you with us this morning and look forward to your presentation. And when you're ready, go ahead and start.
Did everyone hear me?
Yes, sir.
Yes.
Well, good morning to all the Baltimore County delegates. I have a brief presentation. I'll go through it as quickly as I possibly can. And thank you so much for inviting me here on today. Let me see if I can work. Okay, so overall, I'll do a public health overview of what we do in Baltimore County, our COVID-19 response very briefly, where we now from current legislation. And if anybody has any questions, we can go and I'll try to answer those questions at that time. So as everyone knows, our demographics, 830,000 residents, urban, suburban, and rural, the third most populous county in Maryland, and the third largest in area. Our mission is to promote health and prevent disease through education, advocacy, linkage to care, and treatment. Now I'll repeat that. Our mission in public health is to promote health and prevent disease through education, advocacy, linkage to care, and treatment. Now, what I will say to you is the fact that even though it's public health, we have to do this by working with the individual people. For example, if somebody has tuberculosis, obviously that's a public health issue, but the underlying treatment of that, the education of that, is to treat the individual person.
What the hell?
I don't know. You were cooking stuff so fast, I couldn't even tell what you did.
Barb, mute yourself, please.
Okay, so our mission is to promote health and prevent disease through education, advocacy, linkage to care, and treatment, but we do that home to home or heart to heart. So overall, our mission in public health is just simply health. So overview in Baltimore County, we've got different divisions, and I'll just go through some of them so you get an understanding of what we do. Behavioral and community health services. We are the local admissions authority for Baltimore County, and we serve by providing oversight for the mental health, substance use, and prevention and recovery services in Baltimore County. And we also provide information, referrals, and support to our residents and their family members through our 88 reach line. We have mental health services, so we provide crisis response services, including mobile crisis services, and that is through a vendor called Affiliated Sante. And we connect children and adults to mental health and substance abuse services and treatment. We have our chronic disease programs. We have a cancer prevention and awareness program, tobacco cessation program, and a wonderful shelter nurse program that we actually have in our homeless shelters. We provide nurses there to assist with those clients. We have our Maryland Children's Insurance Program, which is the M-CHIP program, providing free health care to eligible pregnant women and their children who have low to average incomes. We have what we call our AIRS program, which is the Adult Evaluation and Review Services, and that provides a lot of community assessment and linkages to resources to our older adults and people with disabilities so that they can remain in the community rather than being institutionalized. We have our clinical services with our WIC program, providing the healthy supplemental foods and nutrition to our pregnant women and their children. We offer a lot of testing and treatment for sexually transmitted diseases and infections. We do a lot of prenatal and early childhood programs, providing prevention programs to combat infant mortality and low weight births. We provide healthy family home visiting programs to first-time parents, and we provide lead poisoning prevention and asthma programs. In addition, in Baltimore County, unlike many other health departments, we are actually in charge of animal services. We have our communicable diseases and environmental health services like other health departments, but in Baltimore County, we also have animal services. In animal services, we're the only open admission shelter in the county, and we take in more than 5,000 animals annually. We have a communicable disease program, and obviously that's to investigate, treat, and monitor infectious diseases, cases like tuberculosis and rabies exposure, and implement outbreak control measures. And then obviously we have what people tend to think about the health department, which is the environmental health services for our food inspections, and then we inspect pools and recreational beaches. So one of the things I just wanted to go over very, very quickly is the fact that fiscal allocations for the local health department. It's obviously a complex web of programs to ensure the delivery and coordination of public health services. We receive both state and local funding to support our delivery, but I have to tell you that we continue to be continue to be drastically underfunded. So our funding is sometimes decreased, but really what happens is that it remains current. It's at a current level. And basically that effectively, it makes us drastically underfunded because every year it costs more money to run the programs. So even by keeping me stable or static at one level, that's basically cutting my budget. Underfunding also makes responses to public health emergencies much more challenging. And I know that the public and everybody's expecting public health to do something when a pandemic comes along, when H1N1 comes along, when Ebola comes along, when Zika comes along. Everybody's like, oh, do something, do something. But when you are chronically underfunded, it's very, very difficult to be able to respond immediately to a particular public health threat. And I will say to you that it's wonderful when there's some money that's kicked in later on, but that's later on, it's months later. And at that particular time, we had so much that we needed to do and should have been doing immediately to be able to address the public health threat. And what happens with this is that we are always forced to build the plane while flying it. So many things have to happen. And so we don't have the IT infrastructure. We don't have the resources. So what we're trying to basically do is solve the issues and respond to the public health threat, but we're building as opposed to having already built the process. With the fiscal allocations, some of the things that we're having now is a lot of staffing challenges. We're going to have a lot of need, especially for our doctors, nurses, social workers, environmental health services staff, our support staff, and IT solutions. This is critical. At this particular time, folks have left being the doctors, nurses, and social workers, the front line. And so we are now scrambling now to be able to get and hire people. So we are competing with the hospitals, we're competing with other private organizations, we're competing with everyone to get these folks. There is clearly a shortage in that staff. So one of the things I want to talk about with COVID-19 is that when we're talking about building the plane while flying, what happens is the fact that we had to respond to this pandemic, and we had 6 additional massive operations that we had to institute because of the pandemic. And we instituted these in addition to continuing to support all those other things that we talked about. So we had to immediately get a hotline going. We had to get safety kit distribution. We had to distribute the PPE and educational supplies. We had to do our contact tracing, outbreak investigations. And in outbreak investigations, we were up to over almost 400 outbreak investigations in our jurisdictions alone. We had to do, obviously, the COVID testing and the COVID vaccinations. Baltimore County did extraordinarily well with that. As you know, that we had probably a state-of-the-art COVID testing and vaccine programs. It was heralded by not only our governor, but there were multiple private industry in other states who would come and see exactly what we were doing at Timonium Fairgrounds to see how we did it, because we were able to actually vaccinate approximately 1,000 people per hour. We never had to get to that level, only because there was a shortage at the time of vaccines, but we were capable of doing that in Baltimore County. So we continue to do a lot of the testing that we have. Our testing now, just to let everyone know, is at 4 testing sites: the Liberty Family Resource Center, the Drum Castle Government Center, Dundalk Health Center, and White Marsh Mall. And we've tested over 150,000 individuals as of February 1st. And then we have our vaccines, and that's at the Liberty Resource Center, Lansdowne Elementary, Solace Point, and White Marsh Mall. And we've administered over 276,000 vaccines, and we've distributed 100,000 test kits at this point. So, mitigating a pandemic during ongoing epidemics. So remember, we had this pandemic, but we had other things that were going on. Obviously, one of the epidemics that we had going on and still have going on is the opioids. So the number of opioid overdoses continued to increase, and the opioid death increased due to the use of the fentanyl. Sexually transmitted infections, I don't know if you know this or not, but in the Baltimore metropolitan area, syphilis cases have been increasing a lot. And so that's another epidemic that we're dealing with, especially during the pandemic. And then mental illness is something that continues, that we have to continue to fight against. And one of the things that we've noted, the numbers are small, but it's very clear to me that we had increases in youth suicide, especially in the African-American community. The numbers are still very small, but I'm concerned. We're watching that. We're out there. We're trying to get some education out there. And the reason why is because when you talk about youth suicide, that was something that African-American children and youth historically did not do. And now they're doing, and they were successful at it. So the number is still less than it's less than 5 at this point now, but that number has increased. And so I want to be able to kind of continue to work with that population so we could actually prevent any future suicides. Okay, so where are we now? We are tired, and I'm going to just admit that, but we are strong. The frontline workers are heralded as sheroes and heroes at the beginning of the pandemic, but now we're being threatened, we're being harassed, and we are being intimidated. We continue to show up for work and help others at our testing sites, our vaccination sites, and the hospital waiting rooms, and they report to work even in inclement weather, on holidays and during the weekends. We are tired yet strong, but we are working close proximity to individuals with the virus, so we're out there on the front line. And they have to compromise their personal health and potentially the health of their families and loved ones because of their love and their commitment to continue to work with folks, even folks who refuse.
Rick, who I never talked to?
That is it. That is
man.
me.
Okay.
I just sound like Butler.
Please
Dude,
mute
you sound like,
yourselves.
an
David
actor.
Butler.
What is that actor?
Okay. All right, then. So even though they may have be high risk themselves or family members high risk, they're still coming in despite the fact that there are people who refuse to get vaccinated, but they're still helping those folks. So They've not wavered, they've not relaxed, and they've not stood down. So I just wanted to bring up this legislation that I know you guys probably know about. That's the House Bill 667 and Senate Bill 298. The threat against public health officials and hospital staff members. I'm talking with you at this point now as the Director of Health and Human Services. And as you know, that means I'm the Director of Health as a health officer, but in Baltimore County, I am also the Director of Social Services. In the Department of Health, I run the animal services. And in the Department of Social Services, I run the foster kids and the adoption programs. So one of the issues that I have in my position as a government official is I remove people's children and I remove people's animals. And that basically puts a target on my back. This particular legislation will provide safeguards against intimidating, interfering with, and impeding a public health or hospital staff member from performing their official duties. I'm going to tell you that right now that this individual, you have seen a picture right here, he has harassed me and all the agency social workers at the Drum Castle site. Staff could not enter or exit the building without being berated and harassed by this individual. He would other individuals to participate in his harassment, and they were outside of our building doing this on a constant basis, and it occurred probably over 6 months. He would show up every day for months, and I won't read out everything, but I'm gonna let the slide be there if you can see it. You can see we're in Drum Castle. He has his big sign made that he put up that's called Dumb Castle. And he started out with home of assholes, liars, scumbag, douchebags, dickheads, dirtbags, incompetent and mandated social workers, and it went on and on and on and on. He actually named my social workers and myself on these signs, and he was doing this constantly. We're to a point where my staff would not even enter and exit from that particular front door. You can actually see right here that this is just we confiscated these knives and these weapons. This is, each picture is a quarter of a year. So we've been doing this and we actually have to confiscate it from them because we won't let them take it in. And then if we tell them if they have these things, they gotta now bring them out and they cannot bring them in. But you can see that this can be very, very, very dangerous to our workers and our children. This right here, we didn't let somebody bring these things in, and they took it and brought it outside and put it in that drain right there on the side of the building. And we were able to find that particular piece of weaponry also. You can see that weapon right there, that brass knuckles with the blade in it would clearly be deadly if it was used. So these are the things that are happening to us. Unfortunately, this is my home, the outside of my home. I was ketchuped, mustard, and egged on the front of my home. As you can see, the door and the window, it was all over my porch. And you can see in the back, they did the same exact thing to the back of my home. Now, I live in Baltimore City, I live in Charles Village, and I live in a row house. My row house is in the middle of the block. The middle of the block. All of that egg, ketchup, mustard, and all of that destruction occurred in the front of my house and the back of my house. So they had to walk all the way around into the alley, into the middle of the block to do this to me. Not one other neighbor received this. This was pinpointed specifically to me. Specifically who did that, I don't know who did that, but I can tell you that it clearly was at a time when the animal advocates didn't, were having some issues with me, and also when I had incidents with this gentleman and other folks who we've had to take their children. So I say this to say, can you please support that House bill and that Senate bill? And that's it for me. If anybody has any questions, I'll be glad to take any questions.
Thank you, Delegate Branch, for the information and updates, as well as the picture and some of the things that you staff's dealing with. I have a question from Delegate Erickson.
Thank you, Mr. Chair, and thank you, Doctor, for being here and sharing all that information with us. I certainly sympathize with you. I've also had numerous death threats and unusual things like that happen. It is sort of comes with the job, and protesters and things like that. So I'm sorry that you're dealing with that. That is stressful. For the gentleman sitting outside, what was the response from police officers? I mean, he's got a right to protest even if we hate what he's saying. Did he lose his children? Do you know what spurred him to do this? And then I have a follow-up about the depression rate.
Yes, we took his child.
Okay.
He could not. He clearly could not take care of his child. And
seems like he might have mental health issues. So
definitely. And I will say to you, the only reason why it stopped is because it just stopped, and he was found in his home dead. And so
killed himself.
I don't know if he killed himself or not, but I know he was found in his home dead. And so then therefore a lot of that harassment stopped, and we didn't know it just stopped. And then weeks later we found that that's what actually happened.
Yeah. Okay. Well, thanks for clarifying that. In terms of the death rates of our youth for suicide, can you tell us the exact number of children we've lost over the last 2 years? What was the increase? What did we used to have, and what do we have today? Because that is one of my biggest fears. That terrifies me.
What I can do is I can actually have my staff forward that through Joel to you guys, so you can get the specific numbers. What I was talking about in my presentation clearly, specifically, was the African American youth.
Yeah.
Right. I know that.
Yeah. And was there any analysis done as to what was going on? Have other children come forward and talked about that they're thinking about it? Why? What's happening?
We're trying to figure this out now, but at this particular time, it's very small numbers. It was less than 5. However, we know that with African American children, that's a lot more historically than we've ever had.
Yeah. I mean, I have to say, I've seen a lot of kids' moods shift over the last 2 years. I think they're so fatigued from all of the drama, many of them. So hopefully we can get to a place of normalcy for these kids soon, because I think it does wear on their psyche. Thank you very much for being here.
Delegate Belcastro.
Thank you, Chair Young. Dr. Branch, thank you so much for being here. I'm really sorry for everything that you're going through right now. I know that myself, I'm a co-sponsor on HB 267, and I know that a number of individuals in this delegation are also co-sponsors on that bill, and we look forward to getting that done for you and the other public health officials across the state. My question to you goes back to the budgeting for our local health departments. You mentioned earlier that you had to pivot and build the plane while you were flying it. That's obviously very concerning to hear. And I'm sorry that, again, that you had to go through that. What do you need so when something like this happens again in the future, that you are ready to pivot and ready to have the resources in place so that you can respond to a public health crisis such as this?
Right. So what happens is the fact that when you don't have the resources, the human resources, the IT infrastructures and things like that, what happens is the fact that you can't respond. So what would actually help us is having additional resources and staffing, that I could create something like an emerging infectious disease division, so that when something is actually happening, I already have staff there who can deal with that. For example, we know that public health threats come up all the time, right? The pandemic was huge, but we had H1N1, we had Zika, we had Ebola, right? We've got influenza. We always have emerging infectious disease that we have to respond to. And what invariably happens is that the public health threat comes up. We all react to it. And then months later, we get a little bit of money that trickles in. And then we got to supposed to respond. Well, we had to respond to that months ago. And so I think that by increasing the amount of core funding that we can get so that we can actually deal with these emerging infectious diseases, that would be very, very helpful. Why did Baltimore County do so well? When I became the health officer in 2006, in 2008, we had the H1N1. And at that particular time, I realized that we had to be ready. So one of the things that I did and instituted with my team is that we would do a flu clinic in 7 councilmatic districts at the same time. And we did that every year. And we did that and we continue to do that. And that was our practice. That was our rehearsal. We were gearing up for the possibility that we would have a pandemic. And lo and behold, a pandemic came and we were able to set up our testing and our vaccine clinics almost very, very quickly, immediately. Now, what I did not have is I did not have the staffing to be able to run these centers. And what I was able to do is work with the county executive and the county administrator, who it was wonderful the way we worked in Baltimore County, because I was able to pull enterprise-wide staff to help us to be able to create these testing and these vaccine sites and the hotline and things like that. And so that was the way we were able to do it in Baltimore County, and I was able to get other bodies immediately. So it was wonderful to have folks from Parks and Recs. It was wonderful to have corrections. It was wonderful to have public works. It was wonderful to have actually administrators come out to assist and work with us. So we were able to pull this off. And that was the only reason why I could actually do a clinic for vaccinations, that I was able to do 1,000 vaccines per hour. We were able to do that because we were able to get staff enterprise-wide. And remember, I wasn't able to go out to agencies and get a whole lot of staff because everybody was pulling from that. So there was a lack of resources globally.
Thank you.
Delegate Long.
Thank you, Dr. Branch. I know it's just listening to you, you've got a full plate for sure. We want to thank you for everything that you do to help protect the citizens of Baltimore County. I recently had a bout with sepsis. Didn't have no idea what sepsis was and how dangerous it is. I know that your plate's full, but I'd like to see more education. I mean, only by the grace of God that I'm still standing here today, or sitting here today. Did somebody recognize that I had sepsis? And I was looking at statistics. It's a high mortality rate with sepsis, especially if it's not caught in time. And I was very fortunate that they did catch it in time and it was dealt with. But thank you. And I want to thank all, for everything that you do. Thank you.
Delegate Long, I'm so sorry to hear that you suffered for such a traumatic disease. And sepsis is clearly very, very life-threatening. And so I will say that I'm glad that you are actually with us to kind of have this conversation. But what you bring up is exactly the lack of resources. There are so many diseases out there that are public health threats. I don't have the resources to be able to educate on all that stuff. So I think sepsis is obviously a life-threatening. It's extraordinarily important, and obviously you suffered through that. But I don't have the resources to go through all of those public health things. The more funding that I can get, the more that I can outreach and touch the individuals of Baltimore County so we can make a difference in their lives.
Delegate Hill.
Thank you. Thank you, Mr. Chairman. And thank you, Dr. Branch, for being here for all the work. You know, as you say, we've been underfunding public health for decades. And I really have two questions. Number one, when we started the pandemic, I believe you made the point you made today that the local public health officers are practiced in dealing with vaccinations, testing, and all that stuff. I want to know if there were things that could have been done differently. Should the Department of Health, MDH, have given more lead to the local public health folks? Should they have taken more of a lead? And then the second question is, to what extent did the Medical Reserve Corps support your mission? And if it did not adequately support your mission, do you have recommendations of what we might do to make it more effective at the local level going forward?
Okay, so one of the things that I think it would be, a couple of things that I think would be very important that we would need if we can do it again is communication. The communication between this MDH and the local health departments while we were going through this pandemic, I think was not the best at all. We did not know what was happening. There were many a times in which we found out that we were supposed to be doing something or something was going to change when the governor made the statement. So I'm looking at the TV going, oh, we have to do that, right? That you can go to your local health department and they will give you a mask, N95. Really? Okay. Where do I get the mask from? We're going to get you the mask. Yeah, but people are calling me right this moment. You just made that announcement. And people are calling me on my hotline asking me for a mask that I didn't know I was supposed to do, right? Great idea. I don't have a problem doing that. But if you don't communicate with me, I don't know that, right? So communication needs to be much better. The IT infrastructure really needs to be much better. When we were trying to do testing, and you guys probably heard all about this, and people were trying to make appointments and stuff like that, right? We built that, we were building that stuff while we were flying. I had my IT people build a database for people who were interested in getting tested or vaccine. I asked them to do it on Friday. And we went live with it on Monday, right? And so then I'm doing that myself, right? So Anne Arundel's doing what they got to do. The city's doing what they have. Everybody did what they had to do. And then people are, now everybody's saying, well, it's not the same and we have a problem here. Well, yeah, because we're building this plane while we're flying. We don't have anything statewide that can actually do that. As it relates to the Medical Reserve Corps, one of the issues, and this happens to be just from the pandemic, I think, everybody was pulled. Hospitals were pulled, health departments were pulled. I will tell you that at the beginning of this, the nursing homes were just ravished. So the Medical Reserve Corps is usually pulling people from within the system, and sometimes from different jurisdictions and states to help a particular area out. But for us in the States, everybody was ravaged. So therefore, the amount of Medical Reserve Corps people that you had was very, very limited, just because the whole entire system across the United States was limited. So I think that we have to probably look at that differently as it relates to a pandemic. I think the Medical Reserve Corps works very, very well when we have a local disaster and then we're trying to send people in. That makes it works beautifully then. But I do believe that from a pandemic perspective, that wasn't the best. I will say to you also that one of the things that I think it happens is that public health is always on a job on Delicate Hill. We are at the restaurants. We are testing the beach waters, the recreational waters. We are already over there at the hospitals, at the nursing homes. We are there. and how we are there. You go to the grocery store, you go to the pools, you send your family to the restaurants and never even think about, well, I wonder if this is going to be good for me or not. We are able to drink the water in Maryland because public health is on the job, and everyone forgets that. And then so now we don't give public health any additional resources or money, not at all. And then we continue to say, you have to be on the job. And to a certain degree, it's our fault too, because guess what? We continue to make it happen. We do the best that we can. And then when our system is stressed, everyone then says, well, why can't you do all this stuff? Because I don't have the resources. So overall, I think that's where the issue is. You got to continue to build the infrastructure. Let's build a skeleton so we can put meat on the bones. And we can kind of put the stuff on there so that we're ready when the next public health threat occurs.
Thank you.
No, thank you.
Dr. Branch, Delegate Shaleka.
Thank you, Mr. Chairman, and thank you for being here, Doctor. I'm just really sorry to hear about your home being vandalized, and that's just really troubling, and pass on to your family that we're, sorry. We'll do what we can to help. It's just shocking. So, clearly this is a pandemic of epic proportions, and I'm hopeful that we, won't see another one of those in our lifetime, but I appreciate the fact that you're talking about building some systems and, should, God forbid, something like this happen, we're prepared. One of your slides was about lack of funding, and I'm just a little bit concerned that there has been an unprecedented amount of money from the federal and state government sent to health departments to make sure that, needs are met. So were you not able to access that money? Give us a little background on that, because I know the federal and state government, have sent unprecedented amounts of money, and, the Biden's infrastructure plan had some money for IT to help, with some of those concrete things, but I'll just go on mute and let you tell us where we are with that. Thank you.
So yes, we were able to tap into those funds. That's wonderful. But let me just explain to you, as I mentioned before, the issue is when the public health threat occurs, Delegate Shaleka, you want me to act right now. I need to take care of stuff now. Not in 3 months, not in 2 months. So one of the issues that I have is I've got to put a hotline up when the public health threat is coming out, and I've got to put that up in 15 minutes because the people are calling in. I may have to do a testing. I may have to do vaccines, whatever it happens to be. Getting me money 8 weeks later didn't help me when I needed it the most. So I am pulling resources from everywhere, and then I'm not doing what I'm normally supposed to be doing because I've pulled those resources initially to deal with the threat. So,
are you proposing to have some kind of reserve fund? Is that, how are you, obviously, we're not clairvoyant, we can't tell the future. And again, we hope and pray we don't end up with a pandemic again. But is that your suggestion? I'm, wondering how you, because, obviously a lot of these were reactionary to COVID. And, so how do we solve this? Going forward, you're talking about an emergency thing, which I'm hoping you got the money, because certainly, again, the feds and the state unleashed, unprecedented amounts of money. Are you saying it didn't get to you fast enough, or you need a reserve fund, or, how do we solve it?
Right. So I think from my perspective, from a local perspective, it's really being able to fund the infrastructure for something like emerging infectious diseases. So that what happens is the fact that you already have the staff on board who could be working on a lot of the chronic diseases that we normally already have, right? We would be able to educate folks on all type of public health things. We can link them to care and do some wonderful, wonderful stuff. However, when you have an emergent infectious disease come about, we can switch very quickly on a dime, and I can deal with that. So I have an infrastructure that's allowing me to work with a lot of chronic diseases. And I think it was Delegate Law who said something about sepsis or whatever. It could be a lot of stuff that I could be doing normally, but then I can flip on a dime and actually then do whatever that emergent infectious disease was. And it's not just a pandemic. As I mentioned to you, H1N1, Ebola, Zika, right? You've heard of all these different diseases that were coming up. So we have an emergent infectious disease a lot of times every couple of years. So it's not as if those people wouldn't be able to be utilized. We'll be utilizing them. However, they would already be on staff for me, so I can actually then work immediately when the public health threat starts. Getting funding after the fact, I am never, ever going to turn any funding away, and we're going to always utilize it. But getting a bulk of money right now, and then I don't have that money to sustain me, then I'm fixing this problem that I have right now, but then I'm not now building that skeletal and that structure so that when the next thing comes along, I'm ready and prepared then. It's as if I'm always building the plane by flying every public health threat. And that's what I think we should not be doing.
Thanks, Dr. Branch. We'll look forward to a proposal for you about how much money you need and, how to move forward, and a future discussion. Thank you.
Thank you. That's enlightening, Dr. Branch. Appreciate the information to knowing that, one, when these things are being prepared for, but not expected when they're going to come, that it'd be great to have reserve funds provided by the state or local government. Look forward to working with every member of the delegation. If we can find state funding to provide a reserve fund that sits ready for you to be used at a moment's notice to meet these needs when they come, and never be cut by folks that say that it's just sitting there not being used when there's not an emergency. Delegate Bhandari, it looks like you have a question.
Yes, thank you, Mr. Chair. Thank you, Dr. Branch, for a wonderful and emotional presentation. Your presentation reminded me the tragedy that happened in our county in May 2021. And that was a kind of high profile case. A guy killed a family and killed Sagar Gimire, a young man who had just graduated college and had such a bright future. He was tragically killed. However, this was not a random incident. The guy had a history of unstable and violent behavior, was troubling. Peace orders had been taken out against him, and there were additional encounters with law enforcement afterward, which raised additional concern about his state of mind. Despite this concern on Mr. Brown's record, he was not referred to mental health support, which may have changed the course of his life. Rather than the question, when I went through the document, 100 pages document that I received from Baltimore County State Attorney's Office, and I read about the red flag law, involuntary commitment, police intervention, mobile crisis center. What I found is there was not an internal effective communication. So I'm proposing a bill. I will follow off.
Question, Delegate Bhandari.
Yeah. So, Dr. Branch, how do you think that these different agencies should communicate? Are you happy the way they are communicating, like mobile crisis center, law enforcement, those type of things? Or do you suggest that we have to do something in Annapolis?
So I think that clearly we need to get from communication. There's a lot of barriers with that communication as it relates to people's medical records and things like that, and what you can actually communicate, what you can't communicate. What you've just described, Delegate Bhandari, is something that I think deserves a lot of discussion. so that we can actually figure out what's the best approach to how we can actually do that in a legal way, right? Because when we see a bad outcome, we're saying, well, why don't we just tell everybody what's going on? And obviously, that's not the way medicine works. That's not the way the law works. And so, yes, I do believe that we can clearly have a lot more communication. I have a concept that I call no wrong door, where irrespective of where a person meets up within our system, that we're able to help them and provide them with information, and then having a lot of those institutions be able to communicate so that we can actually help and assist that individual and protect the other individuals who are around them. So yes, I wholeheartedly agree with you with that. That's an ongoing and much longer conversation that we can actually have so that we can actually help try to develop what you're talking about.
Thank you.
Delegate Brooks.
Thanks, Mr. Chair, and thank you, Docs, for your wonderful presentation. And I must say that I am really disturbed by what happened to you. Protest does come with a job, but not with vandalism. Protest does come with a job, but not with harassment. Protest does come with a job, but not with threats, you know? And we as citizens should condemn this type of behavior in the strongest sense. Yeah. Now to my question. It seems as though COVID really challenged the medical system. When we finally got to the point where some of the restrictions were being released, then came the Delta variant. And after that, then came Omicron, subvariant. Is enough people vaccinated now, boosted, and even infected that maybe by spring we can say we're getting behind us?
I wish I could actually say that, Delegate Brooks. I will say this. We're working on it because we have a goodly number of our seasoned elderly population that's vaccinated. However, when you look at our youth, that is not the case in our young people. And I think we need to get more of them vaccinated. But as you mentioned, we had the COVID, we then had a Delta variant, we then had the Omicron variant. And unfortunately, the way this works out is that we're going to have more variants, right? And so until we can stop the replication of this disease, we're going to continue to have variants because that's what viruses do. Viruses replicate and they mutate, they change because they want to survive. So I would hopefully that if we don't get a virulent variant when it's really negatively affecting us, I would hope that by spring, summer, it would actually be better for us. That is my hope and my prayer. However, knowing how viruses work, that may not be the case by any means. We're going to probably have to have a new normal, and that new normal is going to be with COVID. I think that we're going to be married to COVID. It's just going to be a part of our lives as time goes on. So our goal here is not to overwhelm our healthcare system and to prevent as many deaths as we possibly can.
Yeah, and just a quick follow-up on the suicide. I think suicide with anybody, any kids, is disturbing. In our community, like you said, that's definitely was not one of the things that Black kids do, even though there were challenges, you know. So if you've got just 5, then and you had none, then that's a 500% increase. Yeah. So that is disturbing. I would like, yeah, if you could perhaps, if you doing your investigating, if you could provide what the causes are of that, it would be helpful, and perhaps we can do things to undertake and make sure that those numbers start trending down again. And thanks again, Doc.
Thanks,
Mr. Chair.
No problem, Mr. Vice Chair. Always welcome to have senators join us for our meetings. And I see we have a question from Senator Clarence Lamb.
Thank you, Chairman Young. Appreciate the opportunity. One quick question as a follow-up. I was listening to this from Dr. Branch, and I apologize for what happened to your home. There was an earlier contention that this is part of the job. Do you believe this is part of your job?
Well, I will tell you that as the health officer, as the official person, I recognize that I come under a lot of scrutiny. And I knew that when I took the job, I was going to come under that scrutiny. What was very disturbing to me was that what was happening at times within the health and social services is that my staff were put under a lot of harassment and stuff like that too. So I think that's very concerning. A lot of the harassment and things like that, people disagreeing. I get that. I understand that people disagree. I had my neighbors harass me over the, believe it or not, the trap neuter release. In Baltimore City, they had trap neuter release. We didn't have it in Baltimore County at the time. And I have a lot of neighbors who had cat colonies, even in the back of my home in the alley. And they actually stood outside my home and waited for me to get home and basically came in, I guess, wanted to yell and holler and scream, blah, 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 blah. And I understood that. What I did was I clearly made it very a point to them that this is where I lived, right? And so my neighbors, the ones who lived next to me and stuff, who were upset, they actually told the other ones who didn't live there, okay, this is not the way to do this. I explained to them what I was trying to do. You can't have trap neuter release without the neuter and spay portion. And until I was able to get the neuter and spay portion happening in the county, I could not accept the trap neuter release. Once we were able to do that, then we were able to do a trap neuter release. So I expect people to disagree with me. I expect people to not like things, and I expect people to actually verbalize what their issues are. But there's an appropriate way to do that, and then there's an inappropriate way to do that. And that's what is very, very disturbing to me. Why are you at my house doing this, right? You should have been at the Drum Castle office or somewhere else. Why, those are the types of things that concern me when it becomes very personal, and then it's not only me, it's then also my family.
Understood. I appreciate that. Thank you, Mr. Chairman. Appreciate the indulgence.
Thanks, Senator. Are there any further questions for Dr. Branch? Seeing none, Dr. Branch, thanks so much for presenting to us. I'm sure many of the other members of the delegation may have used the county clinics as well as testing sites. I used both, professionally done, smooth guide through, even after getting a appointment and then having folks walk in, still done within 15 to 20 minutes. Thank you for your professionalism during this time and all the work you've been doing with your staff.
Thank you for all that you guys do, and God bless you.
So I see we have Reverend Jerome Stevens, sir. Welcome. I just wanted to double check. Is the senator here?
Let me check. I don't see him on at this point.
It's okay, no worries.
Okay.
I saw you there, wanted to just double check. We're gonna move into bill hearings, and as soon as he's here, feel free to text me and we'll pick him up as soon as we've done the bill hearing, okay?
Okay.
All right. So we're going to move to the first bill on the agenda. Excuse me. It's HB 309, Baltimore County Homestead Property Tax Credits Notice Pilot Program, sponsored by Delegate Long. Delegate Long, you're ready. And quickly, before you begin, this is a bill that you had last year. Is that correct?
Yes.
Excellent. When you're ready.
Well, last year it was tailored just for the 6th legislative district. And after doing some research, we thought it'd be a good idea to do the whole county. For the record, Delegate Bob Long here to testify on HB 309, Baltimore County Homestead Property Tax Credit Notice and Pilot Program. How this all started back in 2012, the state implemented the Homestead Property Tax Credit application that you had to fill out and submit to SDAT. Unfortunately, a lot of people didn't know about it, and they still don't know about it. What happened was they were put in tax bills. Most people don't pay their tax bills; it's paid by their banks, and a lot of times they're still being sent out with their tax bills. And you know, if your bank's paying paying your taxes, yes, sir, your taxes up in the closet and don't pay no attention to it. Anyway, back in 2012, after hearing from a few people and reaching out to some of my past clients that I've sold houses to, I found out there was a large number of people that didn't know anything about it. So anyway, we actually had Senator Nancy Jacobs come down. We did a press conference to notify people. We don't want to see anybody lose that tax credit, and anyway, it was supposed to go into effect in 2012. They rolled it out and extended it for another year. It's been it's been an ongoing problem. We actually had it where when you went to settlement, they would give it to you and you fill it out. Sometimes it happens, sometimes it doesn't. And usually it's given to you in a package. And I don't know if anyone's bought a house recently, but when you go to buy a house, it's a stack of papers. It might be three inches thick. And they give you stuff to take home and people just forget about filling it out. Anyway, there's several bills talking about this. I know there's, I think Delbert Brooks has one also. And after doing some research last spring, we contacted Ethics and asked if we could send out 300 mailers to get an idea of how many people actually weren't receiving it. SDAT, after we did some research, over 8,200 properties in my zip code in the 6th legislative district received it last year. Last year, but 4,700 properties did not apply, but were eligible. Like I said, we sent out 300 letters and we did ask Ethics and they said it was fine. We received an update from SDAT and discovered that over 60 of the 300 people that we mailed out to were no longer on the list. We assumed that if 1 in 5 applied for the new tax credit. We had approximately 12 people call to let us know that they applied as a result of the notification. We decided to expand the bill this year to include all of Baltimore County. We asked for a favorable vote. We want to ensure property owners that are living in their primary residence that are eligible for this gets this tax credit. At one time, it was automatic, but the law changed in 2010. Actually, my chairwoman Hickson, changed that law, and it had to do with rental properties because people were receiving it, and it was rental properties. It wasn't fair. So that's what this is all about. And I would ask for your support, and let's make sure that whoever is eligible for this tax credit gets it. And thank you.
Thank you, Delegate. Are there any questions for Delegate Long? Seeing none, thank you. We'll continue the conversation in the subcommittee. I see that we have just been joined by Senator Ben Cardin. Sir, it's a pleasure to have you back. Always good to see you in front of us. We've had senators from the State House, and now we have senators from the federal House. So welcome. Look forward to your presentation, and you're welcome to begin when you're ready.
Well, Chairman Young, first of all, thank you very much. I always look forward to this opportunity to meet with the Baltimore County delegation. You all are not too far away since I live in Baltimore County, so this is it's good to be home. I'm sorry that we can't meet in person because of the COVID. I do look forward to those types of visits in the General Assembly itself. I want to acknowledge Reverend Jerome Stevens, who's on the call. He's my eyes and ears in Baltimore County, does an incredible job. He's also responsible for outreach throughout the whole state. So we have a Baltimore County resident who is really responsible for building the bridges to all of our communities in the state with our Senate office. So thank you to Reverend Stevens. Let me just briefly bring you up to date on a few issues, and then if you have any questions, I'll be glad to answer it. It's clearly Team Maryland. I work very closely with my colleague, Senator Chris Van Hollen. The two of us, yesterday, we were meeting with the WMATA people in regards to the transit issues. We have met with the governor. We are going to be meeting this coming week with the Department of Justice to deal with the request for additional support for the violent crime activities in Baltimore. So we are very much Team Maryland. Work closely with all four of the congressmen from Baltimore County, John Sarbanes, Dutch Ruppersberger, Kwesi Mfume, and Andy Harris. So it is Team Maryland. We work with the county exec. We work with the state legislators and the county council people. So it's really good to be with you, and we look forward to any of your concerns. I want to start a little bit differently because we're at a crisis right now in which I want to just applaud the Biden administration and the bipartisan leadership in the United States Congress in regards to developing unity against Russia's aggression in regards to Ukraine. The circumstances are extremely serious. We went through a several-hour classified briefing yesterday, but the published reports make it clear that Russia has amassed troops on the Ukraine border that is capable of overtaking the country. That would be a major blow to the post-World War II security understandings in Europe. It would threaten many of our NATO allies if Russia does this incursion. And it's a signal to countries like China that maybe they should use force to take over Taiwan. So it's an extremely dangerous situation, and it will affect all of us, including the work in the Maryland General Assembly. It'll affect our economic predictions, and it will put a real focus on security issues. So I just mentioned that to you because I want you to be aware that that is something we're following very, very closely, and many of us are engaged. And the good news, we hope to bring out a strong bipartisan bill. I'm part of this that will make it clear that if Russia, Mr. Putin does this, there'll be the extreme sanctions will be imposed, and there'll be unity among the Congress and among our allies on this issue. Let me just bring you up to date very quickly on the other issues. We talked, I think, once before about the American Rescue Plan that was passed in March. The American Rescue Plan was successful in making sure that we had the resources necessary to develop the vaccines we need against the coronavirus and the therapeutic drugs. And as a result, with this new variant, the Omicron variant, which is not too new anymore, we were able to keep down the hospitalizations and deaths. And we hope that we see a light at the end of the tunnel, that this time really will be the end of this change in all of our behaviors as a result of the coronavirus. Part of the American Rescue Plan, as I know you are aware, is to provide substantial help to state and local government. In Baltimore County, $160 million was provided to the county government, which was a total of $304 million since the COVID relief packages have passed. And in education, $217 million was provided to Baltimore County. That's a total of $337 million, including the previous legislation that we passed as a result of the coronavirus. In addition to that, there's rental assistance funds that are available and other relief under the American Rescue Plan. The infrastructure bill is unprecedented in its size. Over $1 trillion that's going to be released for infrastructure. From Maryland, it's going to be over $6 billion, which we hope will accelerate a lot of the transportation programs at the state level for Baltimore County. It also includes funds for the Northeast Corridor for Amtrak. $30 billion is included to try to improve the Northeast Corridor. There'll be funds in there for the MARC service in order to improve the MARC service. Money for broadband, over $100 million to the state of Maryland plus for the broadband. It's direct funding for the Chesapeake Bay, an unprecedented amount, $238 million will be going into the Chesapeake Bay program as a result of the infrastructure bill. And as you know, funds are there for the lead paint abatement issues for our pipes. We have kept alive the red line so that is now available if we get state leadership in support of the red line. And one other really big news is that we now have the administration supporting and funds appropriated for mid-bay. So there should be no break in the activities in regards to dredging of our harbors, keeping them competitive with environmental restoration. After Popular Island is filled, we'll be doing the mid-bay restorations. So there's really, I think, substantial relief here to help in regards to economic development. There's law enforcement dollars. As I mentioned earlier, we're meeting with the Department of Justice next week to provide, we hope, additional resources to Baltimore to deal with violent crime. I've also had conversations with Eric Barron, our new U.S. attorney, well known to you all, in regards to this issue. And then lastly, let me mention that we are still working on the Build Back Better agenda that would provide affordable childcare, provide universal pre-K for 3 and 4-year-olds, housing assistance, substantial housing assistance, substantial relief in here for the climate commitments. We are working on the budget. You are probably aware that in 2 weeks, we run against the continuing resolution deadline. Congress still has to pass the FY22 budget. I doubt if we'll get it done in the 2 weeks, so I expect there'll be another continuing resolution, but we want to make sure there's no drop in government shutdown, but we want to pass the bills. For the first time in over a decade, we have congressional directed funds, earmarks. I can go over the list of all the congressmen from Baltimore County, save Congressman Harris, and all of the, both Senator Van Hollen and I have recommended earmarks, including Baltimore County. I could just mention 2 that are on my list that are in the budget once we pass the budget, which includes the Sparrows Point Park and the Pikesville Armory. But we put out a guidebook, Mike Thomas of my office. It's available. Jerome Stevens can make sure you get it in regards to the FY23 requests, because we want to engage you. We can do, only can go to nonprofits or governmental entities. There's a limited amount of funds that are available, but we look forward to working with you to advance your priorities in Baltimore County through this process. And with that, Mr. Chairman, let me be prepared to answer any questions or listen to any comments that you might have, but I want to make sure you stay on schedule. And again, thank you for this courtesy.
Thank you, Senator Cardin. We truly appreciate all that you do for our state. Yeah, I've got a question on the Voting Rights Act, the John Lewis bill. Where do we stand on that?
Well, thank you for that. To me, it's one of the most fundamental issues. I'm going to go back. I'm really worried about this. We saw the insurrection. I was on the Senate floor when the insurrectionists attacked. I was in harm's way. After that attack on January 6th, there was unity among Democrats and Republicans to never let this happen again and be united in regards to protecting our democracy. Unfortunately, the flames of January 6th are still with us. And it's in those who believe that our election process needs to be curtailed. And we've seen 19 state legislatures around the country pass more restrictive voting rights, not Maryland. Maryland's going in the right direction. So the voting rights bill that was originally authored by John Sarbanes in the House, your congressman, the congressman from Baltimore County, includes minimum protections on early voting, on registration, on drop boxes, things like that to protect the integrity. It also deals with partisan redistricting. It also deals with dark money in our political system, and includes a couple of provisions that I authored, restoring voting rights for returning citizens and voter intimidation penalties. The John Lewis Voting Rights Restoration Act or Advancement Act deals with the Shelby County Supreme Court decision that negated the effectiveness of the pre-certification requirements of the 1964 Voting Rights Act. Those 2 bills were combined into a compromise bill that failed on the floor of the Senate because of a filibuster, and failed the second time because we could not change our filibuster rules. I believe these bills are vital to be passed. I believe the Senate should change its filibuster rules. That's not going to happen in the immediate future. So now I am part of a group of bipartisan senators. We met yesterday twice. We're going to meet again on Monday to try to come to a bipartisan agreement on election reform that will include things like correcting the Electoral Count Act, which was the focal point for the January 6th insurrection, and to deal with the Voting Rights Act of 1964 to try to preserve as much of that as we can, and some other issues where we can reach a bipartisan agreement to get this done. It's not a substitute for the broader bill, but I believe we need to make progress where we can make progress. So I'm hopeful that we'll have a bipartisan bill that'll at least move us forward on some of these issues.
Okay, and secondly, look like Tucker Carlson is supporting Russia, backing Russia, as opposed to our ally Ukraine. And he's saying that he doesn't care if people say that he's a pawn of Putin. You know, what do we say about say commentators taking position on issues that's totally contrary to the position of our country?
We say first, we cherish our right of freedom of speech, even when someone says something that's idiotic and not accurate. So we recognize that. But we also have to recognize what Senator Moynihan said a long time ago. Everyone's entitled to their own opinion, but not their own set of facts. The facts are very clear against what he said. It's just not the case. We've seen Russia's playbook play out on this. We know that they are planting disinformation. We know that they have plants in Ukraine to try to stir up problems to justify Russia's incursion into Ukraine. We know all that. We've documented it. It's factual. This is what all the intelligence agencies are telling us. So the facts are clear in regards to Russia's aggression and their intentions. And the facts are also clear in regards to his outright, I think, racial comments as it relates to our city and to other areas.
All right, thanks. Yeah, all right, we'll open it up now. Do we have any questions? Oh, I see Delegate Cardin. Go right ahead.
Thank you very much. Very briefly, thank you, Senator. You mentioned it briefly. I just wanted you, if you could just comment for just 30 seconds more about, I'm mostly interested in environmental protection issues. I know the big bill is getting toned down and maybe separated into lots of little bills. I know that the infrastructure had some environmental protection funding in it, but I'm wondering what's going to be happening in terms of climate change and other issues, not necessarily local, but more broadly speaking from a federal perspective.
Well, John, first, thanks for your leadership and the Maryland General Assembly's leadership in regards to the climate issues and the environmental issues. Make no mistake about it. We have been able to advance America's leadership on dealing with climate change, even during the Trump years, where he pulled us out of Paris. But the legislature, the Congress, still advanced adaptation and climate change agenda issues. So we were able to work bipartisan to advance our responsible leadership on alternative energy sources, more efficient use of energy, and reducing our carbon footprint. So when we passed the bipartisan infrastructure bill, it included the Surface Transportation Reauthorization Bill. I chaired that subcommittee on the Environment and Public Works Committee. We passed that in our committee by unanimous vote. And it included, for example, electric vehicle charging stations. It included incentives to states to reduce their greenhouse gas emissions in their transportation sector. It included innovative ways to reduce carbon emissions in transportation. So that was included in the bill that passed our committee by a total bipartisan vote and was included in the infrastructure bill. So we have made significant advancements, including in the budget process. For example, the Chesapeake Bay program, President Trump tried to zero it out. We increased the amount of funds going into it. And I think Senator Capito, a Republican from West Virginia, and a strong supporter of the Chesapeake Bay program. So we've had that rock solid support in the Congress to try to advance these issues. The Build Back Better agenda, I hope we can get it passed. There are parts of it that are not controversial at all. For example, we have energy incentives that really put a high priority on renewable energy sources and reduce carbon footprint on reduction of energy. That's not terribly controversial. We have strong bipartisan support for that. We have strong bipartisan support for improving the transportation infrastructure in the Build Back Better that has a large new incentive program for green transportation projects. That's not partisan. Where we usually run into some of the partisan division, it deals with some of the utility issues, and we're going to work on those, as well as trying to develop a price on carbon and a price on and dealing with methane gas emissions. I hope we can get those two issues done. Methane gas emits a lot of greenhouse gases, and it's pretty temporary. There is a solution that the industry supports, and we hope to get that done. And quite frankly, the utility companies, by and large, support carbon pricing. So we're, if we do carbon pricing, the revenues that are raised will be returned to the taxpayers. We're not going to do it as a revenue measure. We do it as an incentive to let the private sector use their ingenuity to reduce our carbon footprint. So I'm optimistic that you're going to see bipartisan progress made on the climate agenda, and I hope we can get the Build Back Better agenda done, because that will help as well.
Delegate Bandari.
Thank you, Mr. Chair. Thank you, Senator Cardin, for your thoughtful leadership. Because of your leadership, our state, county, and the whole world are benefiting. And I would like to particularly thank you on your finding a swift solution and helping United States Postal Service issues. You know, we all know that we rely on USPS for small business needs, medication bills, and soon mail-in ballots. And it is imperative that they are operating to their fullest potential. Just I would like to thank you and our federal partners for that swift action.
First, I want to tell you, I'm not satisfied with the U.S. Postal Service, their delivery schedules here locally. Thank you for the comments. It's just not acceptable, and it's got to change. It's got to change nationally. But when you look at some of the regions that have the worst service schedules, our region is included in that list. They did some extremely outrageous things by removing equipment, by using trailers to store, not even knowing where our mail was, and the list goes on and on and on. We recognize that they had a COVID issue in regards to their workforce. We recognize that issue, and we all have to deal with it. Here's the good news. We now have a bipartisan bill for postal reform. We expect it's going to pass within the next month. It will deal with some of the legacy costs of the U.S. Postal Service so that they'll be on a much better financial footing. Everyone agrees on it, all the stakeholders, including Mr. DeJoy. So we have this is not a partisan issue. We think we can get this done. We do have stakeholders that may try to oppose this. The private delivery companies are not exactly happy by making the U.S. Postal Service more financially stable. But the U.S. Postal Service is the universal delivery system. It's in our Constitution. We have to protect it. We have to get it right. Seniors depend upon their medicines arriving. States depend upon the voting material getting there and votes being cast. We've got to make sure that we have the postal system that we had a decade ago, which was reliable, which unfortunately over the last couple of years has not been.
Thank you, Senator.
Thank you, Senator. Delegate Mangione.
Thank you, Mr. Chair, and thank you, Senator, for being here. And I didn't plan on mentioning much from this, but since you guys did bring it up, I do hope that you and both your colleagues on each side of the aisle can avoid any major conflict with Russia, because it seemed to be pretty quiet on that front prior to recently. So I hope that obviously that's not something that this country is going to go down. But my real concern, a lot closer to home, and you mentioned it, and I appreciate this, is the crime obviously in Baltimore. Baltimore City, if we can't all agree that the crime has gotten out of control, then we have a serious issue there. But it's touched very close to home for me, especially recently and over the last several years, knowing some families who have actually lost innocent loved ones. And like Mr. Chesley Patterson, who was just murdered recently. And it's just heartbreaking to know. Now, I do think some of it is coming into the county as well. you mentioned about the DOJ and extra resources. Is there any, can you elaborate on that at all? And that is great news. And is the extra resources going to be more, I guess, legal aspects, or is there going to be actual law enforcement presence coming in? Can you just talk a little bit about that, please?
Sure. And by the way, to me, the way to judge whether we're being effective or not in bringing down violent crime in Baltimore is the homicide rate. We've got to get the homicide rate significantly reduced. It is an indication of the violence in Baltimore, but also it has a major impact on businesses locating in Baltimore, people visiting Baltimore, and the future of Baltimore. So and by the way, Baltimore County is very much tied into the future of Baltimore City. So our goal, make no mistake about it, I've talked to the mayor about this, I've talked to the U.S. Attorney about it, we need to get the homicide rate down. That's not easy because there are a lot of small violent gangs operate in Baltimore that do a lot of retribution murders. And it is a challenge. We have the drug issue in Baltimore. So it's not easy, but it's got to be done. So we are asking the Department of Justice to categorize Baltimore as a major city, similar to how they do Chicago and other cities of our size in regards to violent crime. So that's one. That classification gives us a higher level of attention on federal partnerships. Secondly, there's community innovative funds that are available that from the federal government where we engage communities to root out the criminal elements. We were asking for additional funds in that category, and I'm optimistic we're going to specifically get those funds. The specific ask of the Department of Justice on resources deal with ATF officers, which Baltimore would like to have more ATF officers directly assigned to Baltimore City. It also deals with Eric Barron having additional personnel to prosecute at the federal level, so it would be additional resources for the U.S. Attorney's Office. And then lastly, we have a Joint Strike Task Force that operates out of Baltimore that includes all stakeholders, including, by the way, the police departments of Baltimore County are part of that Joint Strike Task Force. We want to see additional resources given to that Joint Strike Task Force. Part of that would be to work with the Baltimore City Police Department and State's Attorney's Office to concentrate on the types of prosecutions we think are important to get the most violent people off the streets, and backfilling it with community support so that there's not just another violent gang that comes into the community. So it's a combination of factors, but more personnel, different classification, and engaging all stakeholders in a more effective way, and accountability standards to make sure that we really achieve the results.
Thank you very much for that answer, Senator, and I appreciate it. And I met with some of these local business owners and some, like I said, some family friends. I'm very connected with the Little Italy area, and that's certainly moving in the right direction. And they're begging for help, and the more that you guys can push, I'm sure that they are extremely grateful. So thank you very much, Senator.
Delegate Shaliga.
Sorry, I hit the wrong button. Thank you for being here, Senator. Very, very pleased to hear that you're taking action on the crime in Baltimore City. It is extremely troubling, and as you know, it is spilling over in Baltimore County. We have had a record number of homicides in Baltimore County, and the carjackings, the violence that's coming is very troubling. So thank you. Please do more of that. And I love that you're going after repeat violent offenders and gang members. You know, I think if the city won't do it, the feds have to step in. You know, obviously Governor Hogan has committed money to it as well. But I would just like to set the record straight. In the beginning, Delegate Brooks said that Tucker Carlson is supporting the Russians, and then you made some comments, racial comments about his comments. And I don't know, I would encourage you to watch his show and not just listen to MSNBC. Tucker Carlson is not supporting the Russians. He's making comments about whether American troops should be committed to Ukraine. That's not supporting the Russians. So Senator Cardin, do you support sending men and women, American men and women, into Ukraine?
First, Kathy, thank you for your question. The answer is no to that. I can answer that very quickly. But My comments about him is his comments about Baltimore, which I found to be just outrageous. I must admit, I have not followed his comments in regards to Russia, so I have not. But in regards to Baltimore, I have followed his comments, and I find them outrageous. What we are going to do, and to make it clear on Russia, we're in unity with our NATO partners. We'll make it clear to Russia that if they dare to compromise the territorial integrity of any NATO partner under Article 5, we will honor our treaty commitment to defend the sovereignty of every one of our NATO partners. At this very moment, I can tell you that Lithuania, Poland, Estonia, all feel threatened by what is happening at this particular moment. They are NATO partners. Ukraine is not a NATO partner. President Zelensky is not asking for US troops or NATO troops. We will not provide troops. The previous question, as far as trying to avoid a military confrontation with Russia, absolutely, that's one of our highest priorities is to avoid a military confrontation. But make no mistake about it, there'll be severe economic sanctions that'll be imposed. And although economic sanctions are not necessarily an attack of use of military force, it is a militant action when you take sanction activities. We already have sanctions against Russia. So it will heighten the contact. But I can tell you, knowing Mr. Putin already has compromised the sovereignty of Georgia. He's already compromised the sovereignty of Moldova. He's already compromised the sovereignty of Ukraine. And if he's given the chance, he'll do the same thing with Estonia, Latvia, Lithuania, Poland, Hungary, the list goes on. And we cannot allow the security of Europe. And if that happens, there's not going to be further behind China using military force to take over Taiwan. We can't allow that to happen. The security fiber post-World War II requires US leadership on these issues. So we will be there, but we will not be using US troops in Ukraine. That is clear.
Thank you so much. And finally, I would just encourage you to watch the Tucker Carlson segment on Baltimore City. It was not racially motivated. It was talking about the failures of Baltimore City public schools, where there are 2 children at Patterson High School that are on grade level and the rest of them are not. I mean, these are sad and heartbreaking facts about what's going on in the school system in Baltimore City. And I hope all of you will come to the aid of these kids, because if we can't offer an adequate public education and make sure that our children can read and write, we are failing them miserably. Thank you.
Thank you, Delegate. Delegate Metzger.
Yes, thank you, Mr. Chair, and thank you, Senator Cardin, for being here. As you know, I've been working very hard with our Congressman Dutch Ruppersberger and others about the post office. And I think you were there at the press conference. We had an audit and we had it in our hands. And we said, now that we have an audit, we can do something. We haven't heard a thing about the audit. Can you kind of update me about what's going on with the audit?
Well, thank you. As I said earlier, we're not satisfied where we are in Baltimore. So there is still a unique problem. That audit, we have gotten some briefings on it. There's been some changes made as a result of the audit. So there's been some progress. Congressman Ruppersberger has taken the lead on it, and he has done just a great service to the community in keeping a spotlight on this. So the audits, there's been some preliminary information that's been made available to us. I don't think a final report has been issued yet, but as a result of that, there's been some changes already made in Baltimore. And part of it is facility upgrades. We need facility upgrades, but we also need a culture there from its leadership that doesn't try to hide the problem, but to fix the problems.
Well, they don't like to see me at Essex or Dundalk. There has been major problems with management there. And I think that's number one. I've had the postal people stop by my house and tell me, Delegate, you've got to get rid of the management. So we've got to come up.
There's problems there. We recognize that. As I said, there's some problems that we have to deal with.
Abby, have a good day. and a good
Thank you,
week.
Delegate.
Thank you.
Delegate Lee. Delegate Jaleesi. Hope you're muted.
Thank you very much. So my question is a little bit different. I wanted to know what are we doing about cybercrime? I've had several people complain about money being taken out of their bank accounts. And Baltimore County Police has a cybercrime unit. So does the U.S. Attorney for Maryland. But it seems like Baltimore County Police at least gets stonewalled or roadblocked when they get to certain internet providing companies, the iCloud type services. So is there something, Mr. Cardin, that can be done to provide more resources, at least to the U.S. Attorney's Office? They've just opened up their national, I think it's called National Security and Cybercrime Unit, but I'm sure they need to expand it because I hear this all across the country and in my district.
Well, Jay, we have increased dramatically our support in regards to cybersecurity. We have coordinated it through the Department of Homeland Security and Department of Defense. National intelligence agencies are also very much engaged. We have the most sophisticated cybersecurity capacity in the world. We are sharing that with our allies, and we're sharing it with the private sector. The amount of cyber incursions that occur every second are, as you know, astronomical. So many businesses have been compromised through cyber attacks. Many times they don't tell us about it. Sometimes they do. Many times they try to handle it on their own by paying ransom with ransomware. It is a very, very serious challenge. But make no mistake about it, we have the best capacity in the world to deal with this, and we are dealing with this, and we are putting up the resources. The most recent effort is included in bipartisan legislation that we hope to enact during these next couple of weeks to deal with the challenges from China. It passed the Senate several months ago. It's passing the House as we speak, and we're going to have a conference committee to reconcile the differences. It deals with supply chain issues. It deals with competitiveness issues with China, but it also deals with the cyber issues. So we recognize that we have foreign actors who are trying to compromise us, China, Russia, and others. We also have corporate and criminal elements that are trying to compromise us. And then we just have the independent operators who are just they think their own recreation trying to compromise our systems. So we are very much engaged on this. And I can tell you, the cybersecurity center of the world, the epicenter for cyber is here in Maryland at Fort Meade. So we are ground zero on all those efforts. And I have seen it firsthand. These are dedicated professionals. They're the best in the world. And we're giving them the resources and tools in order to keep ahead of the criminals.
One have to move on.
One follow-up. You're right. And the biggest issue is reporting by individuals and banks where these accounts get hacked. But I think the also issue with people faces while all this inquiry is going on, maybe there's a way banks can make those people whole, because if you lose your life savings, then you're kind of stuck for the few months that the investigation is going to go on. So is that something you can look into? Because people telling me 40,000 is gone, 50,000 is gone. And the bank says the FDIC insurance doesn't cover any money that is hacked out of their accounts.
Well, absolutely check that out. We've also worked with the IRS in regards to, as you know, identity theft, which is widespread. So it's the same thing with banking institutions where you get identity theft where people try to steal your money. So yes, we'll absolutely work with you on that.
Thank you very much. Appreciate it.
Thank you, Delegate. Last question, Delegate Grimmer.
Thank you, Mr. Chair. And Senator, thanks for being here today. So I lived through two major wars, Iraq and Afghanistan. Both were a humanitarian disaster. I think one thing COVID has proved is that our country is actually very vulnerable, specifically due to the supply chain issues. And if you pay attention, for example, to what Russia's doing with ammonia and natural gas, a Cold War with possibly two countries would be very impactful to us. You said today that sanctions are a military action. I would agree. And I just wanted to make the point that before we take any action at
Can you make
all,
a question, Delegate?
yeah, we are constitutionally bound if we're going to take military action to declare war. And can you commit to that before we go about poking the bear with Russia and China, that you'll commit to either declaring war or not getting involved with these countries?
Well, yeah, I absolutely agree with you, but I'm not sure. I didn't mean to say the sanctions are the use of our military. It's not a military action. It is a hostile action. It's not necessarily a military action. It's not necessarily the use. So it is, and we've used sanctions. As you know, we have sanction regimes that sometimes go against our closest allies for activities that they're involved with. So we have Magnitsky type individual sanctions. We have sectorial sanctions. We have a lot of different sanctions. It's in our diplomacy toolkit. So I don't mean to apply the use of sanctions requires a declaration of war or the use of an authorization for the use of military force. I strongly support, and I've been one of those who've been most outspoken about this, that the Constitution gives Congress and only Congress the right to declare war. The President of the United States has Article 2 powers to protect us and keep us safe when he has to use military to defend us, or if there's an urgent situation that requires immediate action where Congress cannot act. That unfortunately has been misused by previous administrations, and that's why Congress passed the authorization for the use of military force law, the War Powers Act. And that makes it very clear that after 60 days, when troops are introduced, the president's authority ends and Congress has to authorize the use of military force or must remove the troops. In 2001, we passed an authorization for the use of military force in regards to the Afghan attack on our country. 4 administrations have now used that to expand our operations throughout most of the world and say that they have the authority from Congress. I don't believe they do. I don't believe the 2001 authorization gives the president that right. So I'm in total agreement with you that before any decision would be made to introduce American troops into a hostile territory, Congress needs to be consulted. And if troops are going to be deployed, Congress needs to authorize those troops.
Thank you for the question, Delegate. And also, not to add any comments or make light of anything, but there's only one organization from the military that can be activated for any period of time before declaring war.
Which one is that?
The Marine Corps, Delegate. Semper Fi. Sorry, Senator Baker, I didn't mean to.
No, look, the president he's commander in chief. We have troops all over the world, but they're by the invitation of the host country. And we do counterterrorism activities without the consent of countries. We just did one in regards to Syria. That could be done, but that's not the introduction of troops for the purposes of combat. They are activities that fall under the covert activities that are done that have been authorized indirectly by Congress that does not require a specific authorization. That's a different situation. And you're right. The Marines are almost always called on to do that. So you're absolutely right about that. But that doesn't even come, some of that doesn't even come under the Department of Defense. It comes under the CIA and the intelligence communities, which we never acknowledge.
Yes, sir. Sorry, Senator, I made an inside joke to one of the members of the delegation. But
that's all right.
I appreciate your time.
But it's an interesting discussion about covert activities and how covert activities are done, and what the president can do and can't do. He can always send troops in to defend us. If we have Americans at risk, the president has the right to send troops in and the obligation to send troops in to defend Americans. So we do have certain rights that are under Article 2. The president has those authorities. But for war, it's Congress, and Congress should take that responsibility before men or women are committed to battle.
Senator, we appreciate you coming, as always, and your professionalism and knowledge of the issues that we bring up. And you're all we can expect a professional answer. And thank you so much for your time. And welcome you back anytime you're welcome to have time to join us.
Stay well, everybody. Thanks.
Thank you. Moving on to, on a tight schedule now, we're going to move to HB 446, Baltimore County Disposition of Marriage Ceremony Fees, sponsor Delegate Forbes. Delegate Forbes, when you're ready.
Thank you, Mr. Chair. Good morning, everyone. This is testimony in support of HB 446. This is a bill which will increase the amount of funding the Baltimore County Historical Trust receives from the performance of courthouse wedding ceremonies. And I'll explain that. So in the 1960s, there was federal legislation that required states to protect historically significant buildings and invest in historic preservation. In Maryland, we opted not to make this part of government operations, but vest that responsibility in nonprofits. In Baltimore County, we have the Baltimore County Historical Trust, which does business as the Preservation Alliance of Baltimore County. And this is where it gets wonky. The trust and other nonprofits across the state receive their funding through a Maryland family law statute. And so when courthouses are performed at the wedding, or weddings are performed at the courthouse by a clerk or a judge, there's a $25 fee. And in 9 jurisdictions across the state, part of that fee goes to support historical preservation. In Baltimore County, and most counties, Cecil County charges $30, but all the other counties charge $25 for a courthouse ceremony. $10 goes to the general fund of Baltimore County and $15 goes to the Baltimore County Historical Trust. This bill would give the Baltimore County Historical Trust all $25. The Preservation Alliance has struggled to do the important work they do with their current funding levels, and the pandemic really decimated them. When the courthouse is shut, no marriage ceremonies were conducted, and their income, this is their main source of income, and it went to zero. I worked with them last year to get a humanities grant, which made them nearly whole. But even before the pandemic, they were approaching a point where their work was unsustainable with the funding provided. And in real numbers, before the pandemic, they were getting about $36,000 a year from these $15 funds. With this increase, once the pandemic is passed, they will get about $60,000 a year. I appreciate that this bill has the support of the county executive, and I appreciate Joel Beller, who worked with me through drafting, and I would ask for a favorable report.
Thank you, Delegate. Questions for the sponsor? Seeing none, thank you very much. We're going to move into a voting session. We have 3 bills to vote on.
Mr. Chairman,
Delegate Metzer.
just as a point of order, maybe because of lack of time and several of us, I'm like 30 minutes behind on a meeting. Could we sustain the voting until next week?
So generally, and I was texting some other folks too, traditionally, the delegation meetings are based on when the session starts, which goes on Fridays, usually 11 o'clock. So if you all have scheduled things between 9 a.m. and 11, because of the virtual session, which I understand, because we've kind of gotten out of a flow, in the future, you shouldn't be doing that. Because generally, we've gone to 11 o'clock or up until the session starts. If we schedule too much time, we end up ending early. But for future reference, we shouldn't plan your schedules that when we have the delegation meeting, usually goes to 11 o'clock. And once we're actually in session again, it will be going to 11 o'clock, bumping up to that time. So if I'm going to move forward with the voting, just because under my timeline, 11 o'clock was the intention. If that was not expected because we've been in this virtual environment, that's fine, but I'm going to move forward with voting, okay?
All right, well, let me ask you this on House Bill 192.
Sure.
Is there a way that we can hold that one until next week and we can move on with the others?
Is there a reason to hold that one?
I think there's some people that have called me just in the last day, emailed me, and I think we might need to put an amendment in or something.
It already has 2 amendments from my understanding.
I'm just asking. That's all I'm doing, sir.
That is correct. There are amendments to that bill.
Is the sponsor open to any other amendments at this point?
No one's, this bill is up for voting. No one has talked to me about amendments, and now, we're at voting, and now somebody's asking me if I don't even know what those amendments are that are being suggested.
Okay. Well, listen, we have it on the bill. It's gone through the full delegation. It's gone through the subcommittee. If folks have additional amendments, the bill doesn't stop here. Feel free to talk to if it moves it out here and comes out favorable, you can talk to the full committee and you can talk to the Senate as well. So with that, I'm going to move into voting session at HB 192, Baltimore County Board of Education, student member voting with sponsor Delegate Ebersol, who is also the chair of our subcommittee on education. If you wouldn't mind giving a report from the subcommittee.
Thank you, Mr. Chair. The bill was considered in Education Subcommittee. 2 amendments were considered. I'm going to describe those amendments. They're also available on the Google website. I will say the number of the amendment so you know. The first amendment that was offered to the bill is amendment number 586-116/1. It essentially says that before the student member would be allowed to vote on matters involving the budget, that they would receive within the first 2 months, hopefully before that, a training on a curriculum developed by members of the board and the office of, and we changed the office name to the Office of Fiscal Services. And that would have to be done first before the student would be permitted to vote on that. The committee moved favorable on that amendment, so I move favorable.
Second.
There's a motion and a second on the amendment. All in favor of the amendment, signify by saying aye.
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 Are there any opposed? And raise your hand if you're opposed to the amendment.
Yes, I'm opposed.
Okay, raise your hand in the reaction button if you wouldn't mind, so I can read
Do
them
we
all.
have discussion? Can we ask some questions or do we have to go right to voting?
Delegate Szeliga, thank you for the reminder. Discussion before the vote. Delegate Szeliga on the amendment.
On the amendment. So it is develop a draft curriculum for budget training for student members. What can you tell us about that? I'd like to know a little bit more about where you're going with this.
So I'm going to defer to the maker of the amendment. That's Delegate Bhandari for that, if we're parsing the language.
Yeah, thank you, Mr. Chair. Actually, my amendment was based on a report by Operational Efficiency Report Review by Public Work, LLC. I think Baltimore County spent close to $1 million. And the report says that is online. I can send Delegate Szeliga later on.
Send it to all of us, please. Thank you.
Yeah, I will say that. So one of the recommendations says that board members don't have a knowledge about so many issues. One of the issues is about the budget. So what this amendment does is on or before December 31st, a work group composed of several members of county board and the executive leadership. It's not just the executive leadership. They will come with the curriculum. They will draft a curriculum for budget training for student member of the county board and submit the draft curriculum to the county board for review. So what it does is it's all about, like, the question were raised in the last bill hearing, that they don't have enough knowledge. So I strongly believe, as an educator, that's a school board, like, if we can teach them, they can learn. They are very smart, they're very committed, then they are very confident. And it was a solution to so many issues that were raised in last hearing.
So so the student, give us the timeline. The student member gets selected from the county board of education. The county schools select, just so I'm sure I'm understanding this correctly, the county board of education, not the board of education, but the county school system selects a handful of students that would then be eligible to be voted on as the student member. Is that correct?
Mr. Chair, if I may, this is on the bill then. The amendment is about whether the student member who is selected is going to have training or not. And given that we need some alacrity, can we stick to I would like to ask you if we could stick to the amendment.
Yeah, I'm getting there, Delegate Ebersol. So I'm trying to get the timeline that goes with the amendment. So the student member is the county school system selects like a handful of members of students to be voted on. There's some election, they're selected. Then when would they get the training? And then when would the budget come before them? Like I'm not getting the timing to understand this curriculum for budget training and how you envision implementing this.
Mr. Chair, can I answer that question?
Yeah.
Each student member shall be required to complete the budget training. And within 2 months of the student members' elections to the county board, I consulted with the board members. So this aligned with the exact timeline.
So they get elected when? Do you know when the election is?
I can get back to you.
Okay, that'd be good. And then,
Yep.
Mr. Chair, if I may, for the answer to that question.
Sure, go.
I think Delegate Schlega, I'm not Delegate Schlega, I think Delegate Forbes has information on when the board member would be sworn in.
Delegate Forbes?
The board member sworn in July. The first vote on a budget is in September on the capital budget.
There you go.
so they get sworn in July, and then they start voting on billions of dollars worth of school funding for capital projects just 2 months later. And they're, probably what, 16 at that point?
Again, Mr. Chair, point of order.
That's not about the amendment.
Okay. All right. Thank you.
Okay, another question on the amendment, Delegate Erickson.
No, I was raising my hand from
Oh, my
before.
bad.
Sorry.
No, that's fine. No worries. Any other questions on the amendment? All right, all in favor of the amendment signify by saying aye.
Aye.
All opposed, raise your hand in the Zoom. I see Delegate Bodler is opposed, Delegate Mangione is opposed, Delegate Grammer is opposed, Delegate Erickson is opposed, Delegate Schlega is still opposed. You're okay with the amendment, got it?
This amendment, all it does is it required the student member to have training on the budget, right? We're not
Agreed.
voting on
Yes,
the
it
full
does.
bill.
Once again,
This-
yes, asked and
this is-
answered, that's correct.
Okay, I'm fine with that.
Wait, I have a question now because that's not the bill that we moved.
We didn't move a bill. We are voting.
No,
on
I'm
the
sorry.
amendment.
I'm in subcommittee.
There are two.
Delegate
there are
Erickson,
two
we're on
amendments.
the amendment to the bill.
This is the first amendment.
So I just want to make sure I understand. When we moved a bill in subcommittee that we had amended, and then I had to go to Harford County and I had to come back. And then we added another amendment. I thought the second amendment that we added eclipsed the first amendment and included the entire group of people, the student and all of the other board members. Is that?
Mr. Chair, if I may, we did have two separate votes on the amendments, but I believe it's procedure that because the committee puts the amendments on, the delegation doesn't automatically do that. We bring the recommendations of the committee to the delegation. And
Yeah.
since we adopted both of them, we are bringing the adoption of those amendments to the delegation.
Okay, so the second amendment that we're going to present today makes this amendment obsolete.
Well, it adds in the other members, but we haven't discussed that amendment yet, and we're not on that amendment.
I'm sorry.
This
So
amendment, my understanding, excuse
this
me.
one won't
Excuse
matter
me.
anymore once we
Excuse me.
adopt the second one.
Excuse me, my understanding is, and this should have been in the discussion. I'm still counting the folks as not voting or supporting the amendment. This amendment includes the training for the student member of the board. The amendment that we're about to hear, and I only know this because I've discussed it with the amendment draft, the sponsor of the amendment and the sponsor of the bill. The amendment will add the other members. So it doesn't supersede, it adds the other members. This one-
Okay, I understand now. Okay,
Yeah,
yeah.
great.
Okay.
So I-
I like
I
this.
reported Delegate Mangione
Mike was never in
in
delegation.
opposition.
Wait, no.
It's just voting.
Mr. Chair, the amendment number before us, I'm looking at on my
You got a
computer,
couple more minutes.
is
Yeah, but it takes-
92621/7.
No, you have the wrong,
yeah.
excuse me, delegate, you have the wrong one. I read it as
Oh, this is the
586-116/1.
Okay, can you repeat that because I'm on
Five,
the,
if you're in, are you in the Google Doc?
I am in the attachments that Barb
I
sent.
see. So it's 586-116/1.
Okay, and then the next one, okay, so we're just talking about this first, requiring the student member to have budget training. That's all
Already
this
been-
is on.
as was discussed.
One more time,
and
that's
already
correct.
clarified.
This amendment, 586116/1, adds a student requirement that they be trained on the budget. I
Okay,
can't be any
I'm
clearer
good
than
with
that.
that. I'm not going to vote against that. Thank you.
Great. In opposition, I have Delegate Mangione, Delegate Grammer, Delegate Erickson, and Delegate Bodler. Is there anyone else in opposition?
I'm okay with it now. I thought it
Oh,
was
good.
another amendment.
Excellent. I have Delegate Mangione. Mangione, are you now okay with the amendment? Okay. Delegate Bodler, are you still against the amendment? Got it. I have one against. Motion passes on the amendment. Delegate Ebersol.
Okay, we have another amendment which would add in the other 11 members of the board. They would need to be trained within 2 months, not each year, but at the beginning of their term in a similar fashion. That number is 926217/1 for reference purposes, please. We move favorable on that amendment in the committee, and so I move favorable on it here.
Is there a second?
Second.
Discussion on the amendment. Delegate Shalega?
Yes. Why didn't you include all the delegates and senators in this? If you want the school board to be trained in, the budget, would you take a friendly amendment to make all of us do it too?
Mr. Chair, if I may.
Sure can.
The original purpose of the bill dealt with board members voting on the budget. If we want to have separate legislation about legislators, I believe that would be appropriate in another place, especially generally considering single subject.
Well, it's all right. Thank
Delegate,
you.
Delegate Grammer, got a question?
Yeah, I actually have like a technical legal question. So as written, each member under this amendment would be required to take this training before they could vote. Is that correct?
That is how the amendment is written.
So is there you would essentially be taking away a member's right to vote unless they had this training. Is there like a legal issue there? Because this is going to apply to all of the members of the Board of Education. They have a right to vote on these issues, and this would be superseding that.
I'm going to let the maker of the amendment address that issue.
Yes, thank you, Mr. Chair. Again, this amendment, I relied heavily on the report that Baltimore County government spent over $1 million that I'm going to send it. It says the BCPS board lacks sufficient training to operate efficiently and effectively. I will just read the budget portion of it. But this was the majority of the BCPS board member were interviewed. Okay, interviewed. It was surveyed method. I don't know how they were the procedure and everything about the research. But this is a research. It says budgets, difference between internal service fund, capital project fund, debt service fund, enterprise fund, and the operating budget fund. They don't have a knowledge. It comes from board member themselves. And it is $1 million report that Baltimore County government did. So I mean, I'm okay with that. We can make mandatory or we can make may, but look, Delegate Grammer, I mean, this is the education board. Why it is wrong?
So I get that. I get that, but the chair is right. The question is a legal question. We're not required to have, it would be illegal to take away our rights to vote on the budget. You can't force us to have a training. You know what I mean? I just have a legal question here. You're essentially taking away an elected official's right to vote as it's drafted. Now, I'm not opposed to a training. I just think maybe the amendment should be drafted a little bit differently.
I'm good with that. We can change it shall to may, so.
What I think we should do is just provide the training and not take away the right to vote.
Stand by. The sponsor of the amendment looks like he's open to a change to it. So I'm going to hold the bill and we'll vote on it next week. After he takes Delegate Grammer, work with the sponsor with the language.
Yeah, I'll work with him.
May I suggest that we take a look at the original amendment as well, if we're going to revisit this bill, because it also has a requirement, which I think is, even though the student doesn't have the member, we're granting it, we may consider also not precluding them from voting.
During the
Just have it
discussion, that Delegate Bendari and Delegate Grammer will have related to Delegate Bendari's amendment, yes, that will be discussed. And I encourage the chair of the subcommittee to engage in that conversation as well. It is 11:02. We will hold the other bills that we will vote on until next week. Thank you very much for the discussion, everybody. I'm going to make a motion that we adjourn.
So moved.
Second.
Second.